Niagara Health has expanded its critical care response team program. It started in St. Catharines, but it now has come to the Niagara Falls site this month. We're joined by Elayn Young to tell us more. Elayn, this is an RN-led initiative, you being an RN yourself.
It is. It's an exciting time for us here.
Elayn, who came up with the idea for this initiative?
Well, this is Ministry of Health-led initiative, so we operate in collaboration with them. And we first had funding for the St. Catharines site in 2015. So we started there, and we've been diligently working on the program, and we were fortunate enough to get funding this year to begin rolling it out at our Niagara Falls site. So we're really excited to be able to offer this to our patients and families at the Niagara Falls site, as well as our staff.
This is a team of nurses, doctors, other healthcare providers that normally deal with intensive care situations, ICU unit in situations, but now they're moving out of ICU and going to the wards.
They are. What happens is if there's any concerns on the wards, so a nurse is concerned about their patient, and they can call our critical care response team. One of our critical care nurses will go to the bedside. They'll assess the patient. They'll contact the physician, work with other departments, diagnostic imaging for x-rays and CAT scans and things like that. They can provide medications at the bedside, different interventions to prevent that patient from having to go to the ICU. Sometimes they don't need the whole suite of services that critical care can offer. So we can treat them there, keep them where they're comfortable, and ensure that they're safe and they have all the care and services that they require.
This is key in, I guess, reducing wait times to get into the ICU and also clearing up some space in ICU.
It is. It's really key, especially now with human resources being so scarce and important, that we make sure that we can respond to everybody, but also keep that spot in the ICU for the patient that truly is critical and requires all of those services.
If we look at its implementation in St. Catharines, how often did the CCRT have to come into play?
It was well utilized. The staff that were calling the critical care response team needed that support, and the critical care response team comes while they're providing that support and those services to the patient. They're also teaching and nurturing those newer nurses that are on the medical and surgical units, helping with that knowledge transfer. It's been great for job satisfaction for the staff on the floors, knowing that they have that support when they have questions or concerns.
When would the CCRT come into play as well? Is it heart issues? Is it a loss of vital signs? Is it changes in, I guess, the readings from the instruments? When do they step into action?
It can be any of those things that you just mentioned. And sometimes a nurse just has a feeling. They just have concerns. It hasn't quite manifested itself in a change in the patient's status yet. But basically what we tell them is, when in doubt, call the critical care response team. If you have questions, we're going to come to the bedside and we're going to help out. Sometimes it's just a matter of reinforcing that they're doing the right thing, that they have done what they needed to for the patient, but they just want to make sure that they've done everything that they could.
CCRT currently can respond between 7:30 a.m. and 5:30 p.m. What happens if there's an incident that the CCRT might be needed for outside of that time?
24 hours a day, the physician responsible for any patient can contact our intensive care department physicians, and then they would come to the bedside. And right now, this nurse-led initiative starts at 7:30 in the morning till 5:30 in the evening. And that's just while we are training all of our staff. Coming early in 2023, we will be offering this service 24/7.
Following the implementation of the CCRT, are there follow-up visits by members of the team?
There are. So the CCRT follows up on any patient that they've been called to see on the floor. They'll follow up once per shift or more often if the patient's condition requires it. And also any patient that's discharged or transferred out of the intensive care unit, our critical care response team will follow those patients for the first 24 to 72 hours, depending on the patient's condition and the needs of the patient. And they're just there to help make sure that the patient's on the right trajectory and that we're helping those nurses on the floor in that transition period.
Elayn, is this program funded permanently now by the Ontario government?
This is permanently funded now at St. Catharines and at the Niagara Falls site. So with our new south site coming, this should be a service that we can operate 24/7 for all of our patients.
Elayn, sounds like a great addition to the Niagara Health menu of services. Thanks so much for joining us.
Thank you so much for having me and have a great day.